spent months preparing for this moment, but when it comes to labour, many people feel like they still don't know what to actually expect. I'm an obstetrics doctor. I spend much of my time on the delivery suite, and I have also given birth to 3 babies myself without much medical intervention, apart from the occasional epidural. So in this video, I'm going to break down how you actually know how to give birth, what really happens when you're in labour, and what you should be doing at each stage. I'll be giving you some tips and ideas about the things that midwives and doctors wish more people knew about when they're coming in labour. So whether this is your first baby or not, these tips will help you to feel more confident and prepared for that birth. First up, what is labour and how does it actually start? Well, labour is the process that your body goes through in order to give birth. It usually begins with one of 2 things. Firstly, you might start with contractions. These are regular tightening pains in your uterus that gradually become stronger and longer and closer together. The other thing that can happen is your waters might break. This is when the amniotic sac breaks and your fluid leaks out. Sometimes it comes in a gush or just a trickle. It's usually a clear fluid. It might be straw coloured, so a bit of a yellowish tint. If it's green, brown, or of course if it contains blood, you should seek help straight away. You might also notice backache, period-like cramps. You might find that you actually need to poo more often. You might see your mucus plug. These are all signs of early labour. And this is the latent phase. It can last for hours or even days. You might get contractions that start and stop again, come close together, then spread out. It's your body slowly warming up. Usually if you're in that latent phase, you don't need to rush to hospital straight away if you're not in active labour. Instead, you can use this time to rest, eat and drink, and of course distract yourself. If you aren't sure how you'll actually know when you are in active labour, you can check out another video that I did that covers exactly that. So before I get into my top tips, I want to make sure that we understand what's actually happening. So labour is usually divided into 3 stages. You've got the first stage. This is when your cervix is opened from about 3 to 10 centimetres. The early part, before you get to 3 centimetres, is part of the latent phase. It can be slow, but once you're around 3 to 4 centimetres dilated and you're having regular contractions, you're in active labour. And this is when we would expect that you're having your contractions. You might be wanting to use your breathing techniques, moving around, getting into some warm water, or of course using pain relief if you need it. Anything that helps to pass the time as your body is doing the hard work. So you should stay mobile during this time. This means get into an upright position because that can help to use gravity to push baby down. During this phase, we'd expect your contractions to get stronger and longer than at the earlier part of labour. They should be lasting around 60 to 90 seconds and they'll usually be closer together. So you'll get contractions around every 30 seconds or maybe even up to every 2 minutes apart. Sometimes they can even overlap, and your cervix fully effaces when it becomes really thin during this stage. That's important because a thick cervix can't open up. It needs to become really thin, so fully effaced, and then the dilation part can happen. This first stage of labour is shorter than the latent phase that can take days or even up to weeks. It should be more predictable, but it is usually a more uncomfortable stage. In the second stage, this is the time to push. So once you're fully dilated, you might feel an urge that you need to start pushing the baby out. This is the beginning of the second stage. So fully dilated means you're 10 centimetres, but it also matters how low your baby is, and if your baby's head is still really high, we may recommend, even though you might be in the second stage, we should wait a little bit of time before you start pushing to let your body do more of that work. The second stage can last a few minutes if baby just comes out with 1 or 2 pushes, but up to an hour or 2, depending on what the doctors are looking at, whether you've got an epidural, the position of the baby. Then we've got the third stage. So this is delivering the placenta, and it happens shortly after your baby's born. You can do this physiologically, so your baby just delivers the placenta, or we might give you an injection and help to speed up the process by gently pulling on the umbilical cord. This is called active management of the third stage of labour. Here are some practical and honest tips from me working on a labour ward to help you to make your labour easier and potentially more manageable. So first up, I recommend that you learn breathing techniques. So this sounds simple, but deep breathing can help to reduce your perception of pain. It can also improve oxygen flow around your body and to your baby and help you to stay calm. You should avoid holding your breath or tensing, and we really use those breathing techniques in the earlier part of labour in the first stage. A warm bath or a birthing pool can help to ease contractions and helps you feel safe. Some people like using a TENS machine for the pain, but I have got another video all about your options for pain relief in labour. You should stay active. So you can walk, rock on a birthing ball, sway around. Using gravity really helps the baby to move down with the contractions. Another tip is to make sure that your birth partner's on board with you. You can get them involved in your process of preparing for birth, attending antenatal classes, watching videos like this, so they're ready to help and support and advocate for you. You always want to make sure that they know your birth preferences. Next, do speak up. If something doesn't feel right in your body, or if you change your mind about your pain relief, or you're just not sure about something, tell your midwife. You can communicate freely throughout the labour. You should eat and drink in your early stages of labour unless you've been told otherwise. But labour is a marathon, so fuel up early on. Another thing that can help is chewing ice chips. Next, change position regularly. So you should avoid lying flat unless it's necessary, but as I mentioned before, getting up and moving around. Vocalization is something else that can be really helpful. Sometimes you just need to moan or groan or sigh out loud. It's part of the release of the contractions. And if that's helpful for you, just go for it. This pushing phase is the moment that a lot of people think about when they picture giving birth, but it's not always straightforward. So here are my top tips to help you to push effectively and avoid wasting your energy. First up, choose a position for pushing that feels right for you. You don't have to lie on your back. Many people find that squatting or being on all fours, lying on their side, or using a birthing pool can all be more comfortable. Gravity can also help if you are in the more upright positions, like you're on all fours. And when it is time to push, this is when we say try not to scream or shout. It's tempting, but the sound is actually energy that we want to make use of. We want to harness that energy and channel it down. Channel all your energy downwards. So it might sound weird, but the best way to push is to imagine that you're doing a big poo. It's the closest sensation to the pressure that you feel. It's the only thing that you might have felt that was similar to this before, and it helps you to direct your pushing muscles correctly. We recommend that you use the whole contraction to your advantage. So when that contraction or that surge begins, you take a deep breath, close your mouth and push downwards. You can actually potentially get 3 strong pushes out for each contraction. So with that push, you push as long and as hard as you can before you need to take a breath. Take a quick breath in and go again until that contraction has eased off. Your midwife can help by counting out those contractions for you and helping you to time when the contractions are coming. But don't be afraid to go with your instincts. It may be slightly different if you do have an epidural. That's when you really rely on the midwife to tell you when you have a contraction and when to push. And it might feel a bit different to understand where the sensation is you're supposed to be pushing, but they can help to direct you, don't worry. And finally, my top tip is to rest between the contractions. I know you'll be exhausted, but this is when your body is doing some of its best work. So in between the contractions, deep breathing, close your eyes, even dozing off for a few seconds. It all helps to conserve your energy, ready for your next push. Do you have any top tips from when you were pushing out your baby? Let us know. Here are some things that people don't often expect when they're giving birth. So yes, you might poo during pushing. It's totally normal. Midwives see it all the time. It can be really loud or really quiet. When someone is in active labour, some people scream, other people breathe deeply and silently. There's no right way. You may find that you shake or vomit. It is normal to have these reactions to the hormones of labour, but if they're unpleasant sensations, let your midwife or your doctor know and they might be able to give you some medications to help. Another fun fact is your waters might not break at all until the very end of the labour. We may need to break them for you, or your baby may be born in their sac of membranes intact. Also, the smell of peppermint or orange can help with the nausea you might feel in labour and help you to relax. Some people find that the kind of aromatherapy oils that they arrange around their rooms or just something to sniff in labour can help. Also, you don't have to give birth on your back. Side lying, being on all fours, kneeling or being upright can make pushing easier. So giving birth is a powerful, unpredictable and different experience for everyone, but knowing what is coming and what your options are for the process can help you to feel more in control. All of these tips are great if you are aiming for a vaginal birth, but also remember that birth is unpredictable. You might do all of these things that you were supposed to do, but some variables are outside of your control. Just try to keep an open mind about the process of labour, stay positive, and ask lots of questions. Your birth is your personal journey to meeting your baby. So if you've given birth before and you've got any tips, please do share them below.